The ear, located next to the face, often goes unnoticed unless there's a significant flaw. The main concern is its prominence. To define a prominent ear, we must understand beauty standards. Typically, the ear's angle with the head is 25 to 30 degrees. However, in some, especially with elongated heads, the ear may still seem prominent. If we only consider the distance from the ear's edge to the head, it should be 15 to 20 millimeters. In cases where the head is slightly further back, even a normal ear might appear prominent. The ear angle with the head is 25 to 30 degrees in some, especially with elongated heads. Smaller ear angles appear prominent. If only considering ear to head distance, it is 15 to 20 millimeters. Thus, if the head is further back, a normal ear may seem prominent. This prominence is hidden in women with long hair, but noticeable in men with short hair. If only considering ear to head distance, it is 15 to 20 millimeters. Thus, if the head is further back, a normal earlobe may seem prominent. In men, short hair can make ear prominence more noticeable. Let's explore factors contributing to prominent ears. Examining ear anatomy, the outer fold, or helix, is cartilage folded over itself. This folding gathers the ear. If the cartilage lacks necessary folds and is congenitally open, can lead to prominence. Let's explore factors contributing to prominent ears by examining ear anatomy. The outer fold, or helix, is cartilage folded over itself, causing the ear to gather. If this cartilage lacks necessary folds and is congenitally open, the ear appears larger. Internally, the antihelix often doesn't form well, leading to prominent ears. The helix, a folded cartilage, gathers the ear. If it lacks folds and is open, the ear looks larger. The antihelix, located internally, often doesn't form properly, causing prominent ears. The inner ear's dome-shaped cartilage, the concha, can be overly developed, pushing the ear outward. The ear appears larger due to this fold. The fold located more internally is the antihelix, which often doesn't form well, leading to prominent ears. The inner ear has a dome-shaped cartilage called the concha, which can be overly developed, pushing the ear outward. A combination of these factors can cause prominent ears. Prominent ears do not impair hearing and are corrected for aesthetic reasons. In childhood, prominent ears can lead to teasing, causing emotional distress. Sometimes a combination of factors can lead to prominent ears. It's important to know that they don't cause hearing issues, and correction is purely aesthetic. Unfortunately, in childhood, peers may tease individuals with prominent ears, causing emotional distress. Many adults, even over 50 or 65, seek correction because of childhood teasing, showing its lasting impact. Fortunately, ear surgery is low risk, outpatient, and can be done with local anesthesia in adults. It can have a psychological impact on the individual. I've seen many cases where someone over 50 or even 65 years old comes in, and even when told their ears are normal, they say that because they were told this, they wish to correct their ears. Ear surgery is low risk and outpatient. Adults can have it with local anesthesia. It takes an hour and they can resume activities. They can work the next day. The psychological impact led the individual to opt for surgery. Ear surgery is low risk and outpatient. In adults, it's done with local anesthesia. The procedure lasts about an hour. The incision is behind the ear. Despite the ease of ear surgery, understanding the surgery conditions and post-operative care is crucial. There's no need for anesthesia. Ear surgery is straightforward, but it's crucial to understand the conditions and post-operative care in advance. Behind the ear, most of the time, people aren't worried about the incision site and its consequences. Despite the great ease of ear surgery, it's important to know the conditions of this surgery in advance and understand how the post-operative care will be managed. Alongside the protruding ear, it's important to mention that some individuals have a structure next to it, possibly a remnant of evolution. This structure, called Darwinian tubercle, can contribute to the protrusion and affect appearance. We can correct this by removing the cartilage while addressing the ear protrusion. If a baby is born with protruding ears, early intervention with ear molding can help. This must be done within the first few weeks, as the ear cartilage becomes rigid later. For children under 5, surgical correction is not recommended. If a baby is born with protruding ears, early intervention can prevent this. In the first few weeks, taping and molding can help, but after this period, ear cartilage hardens. We don't recommend surgery for children under 5. Before school age, correcting the ears can prevent psychological issues. Awareness of appearance at school can have a significant impact. Correction can address psychological concerns. After the initial weeks, ear correction is possible anytime. For children intolerant to local anesthesia, general anesthesia is preferred. Adults can undergo the procedure with local anesthesia. We can correct a child's ears before school to prevent issues. If aware of appearance, correction might only address psychological issues. Ear correction can be done anytime. Children intolerant to local anesthesia may need general anesthesia. Adults and those tolerant can use local anesthesia. Some children, around 7 or 8, tolerate surgery with local anesthesia, but most fear needles and avoid it, similar to dentist visits. They also fear ear correction, so sedation or general anesthesia is recommended. We can correct the protruding ears afterwards. For children, we do the ear correction under general anesthesia. However, for adults tolerating local anesthesia, we can do the same procedure with local anesthesia. Most kids fear needles and avoid it. We recommend sedation or general anesthesia. After surgery, a light dressing is placed for 24 hours. Afterwards, remove dressing and start medications. Kids who aren't afraid, around 7 or 8 years old, can easily handle this surgery with local anesthesia. And there have been cases like that. But most kids are generally afraid of needles, just like they fear going to the dentist, and they try to avoid it. They also have a fear of correcting protruding ears. So we recommend that this procedure be done under sedation or general anesthesia. After ear surgery, a light dressing will be on the ear for 24 hours. Then it can be removed and medications can start. Avoid activities that pull on the ear for 6 months to a year. This includes sports or anything that might stretch the ear. The success rate of ear protrusion correction is high and recurrence is rare. We know that in post-operative care, it's best to avoid any activities that could stretch the ear for at least 6 months or ideally for a year. This includes any activities or sports that could put pressure on the ear or cause stretching. We should avoid these activities for 6 months to a year after the surgery. Fortunately, the success rate of surgery for correcting protruding ears is very high, and we can say that there are very rare cases where the previous condition might recur, meaning the ear could become protruded again and return to its original shape. We can implement some solutions for prevention ourselves, and we can say that the risk of the protruding ear returning is almost only 1 or 2%. Most of the time, the results of the surgery are permanent and last until the end.